endocrine system. In the 60210, partial thyroid lobectomy unilateral. Partial thyroid lobectomy means generally the thyroid gland looks like this. If the physician removed 1/3, 2/3, 3/4 like that, we call it as partial lobectomy unilateral. 60212, partial thyroid lobectomy unilateral with contralateral subtotal. Contralateral subtotal means what? Opposite side also half. One side half, opposite side also half. What we call it as contralateral. Total thyroid lobectomy. One side, either it may be right side or left side, total lobe they removed. You can see the quotes now. Contralateral subtotal means one side total, opposite side half. 60240, both the lobes they are removed. Now try to read the code descriptions. Are you there, everyone? 60210 means partial thyroid lobectomy. What does it mean? See, this is a thyroid gland, normal thyroid gland. On any one side, if they removed 1/3, 2/3, we call it as partial. 60212, partial thyroid lobectomy unilateral with contralateral. One side half, opposite side also half. That is 60212. 60220, total lobe. It may be left side or right side. Total lobe, if they are removing, we call it as 60220. 60221, 60225, contralateral subtotal. That means one side half, one side full, opposite side half. 60240, both the lobes are removed by the physician. 60252, removed for malignancy. Up to 60254 you can mark as important. Any doubts in this one? Those quotes? Unable to understand? Unable to understand? Shobha?
Sir,
Anyone?
did not understand, sir. Come again.
See, you can see here. This is the normal thyroid gland. Okay, how many lobes it is having? Two lobes, right lobe, left lobe, connected by isthmus. What the physician is doing, he is removing half of the lobe. It may be right side or left side. We call it as partial lobectomy. Physician is removing half lobe from one side, opposite side half lobe. What we call it as partial lobectomy unilateral with contralateral subtotal. Contralateral means what? Opposite side. What the physician is doing next one, he is removing the total lobe. It may be right side or left side. Next one is one side total lobe, opposite side half. Next procedure is both the lobes they are removing. This is the procedure done by the physician. If you see this diagrammatic representation, partial lobectomy. If you see this diagrammatic representation, partial lobectomy with contralateral subtotal. If you see this diagrammatic representation, this is lobectomy. This is lobectomy with contralateral subtotal. Both the lobes are removed. That's what we call it as thyroidectomy. Understood? See the questions. Question number 18. Question number 18. Question number 18. Can anyone read the question? Question number 18.
Patient has a right thyroid lobectomy for a thyroid follicular lesion. An incision is made 2 cm above the sternal notch and carried through the platysma. The right thyroid was dissected free from the surrounding tissues. The isthmus was divided from the left thyroid lobe. The left thyroid lobe was explored, revealing a single nodule. The right thyroid lobe was completely removed from the trachea and surrounding tissues. It was marked and sent off the table as a specimen. What CPT code is reported?
Okay. Now if you see here, partial lobectomy is done, or lobectomy is done, or lobectomy with contralateral lobectomy. What is done here in the scenario? What is done by the physician in this scenario?
Right thyroid lobectomy completely removed.
On which side?
Right side.
Right side. That means lobectomy unilateral. Yes or no?
Yes, sir.
Okay. Now search the code. If you go with the code description 60200, what it is? 60220. That is excision of cyst or adenoma. This is not the procedure done. 602100, 60210. This is partial thyroid lobectomy unilateral. Total lobe removed by the physician. 60220. Total thyroid lobectomy unilateral. Now 60220 is the procedure done by the physician. C is the answer, everyone. Understood everyone the scenario here? Understood everyone? Any questions in this question?
No, sir.
Next one. Now see question number 16. Question number 16. See, what is the scenario here? Can anyone explain what is the physician doing?
Partial removal of right lobe and left lobe.
That means partial lobectomy with contralateral subtotal lobectomy. Yes or no? On both sides, half they remove. If you see 60210, that is only partial lobectomy. The next code, if you see partial lobectomy with contralateral subtotal lobectomy, is there or not? Nahin, why you coded A? Can you read? A means two codes you have coded. 60210, 60212. How we will read 60212?
Partial thyroid lobectomy,
Hmm.
unilateral with contralateral subtotal lobectomy, including isthmectomy.
What does it mean?
It means the partial removal of contralateral, mean the opposite side of the lobe,
It means
another lobe.
right side half, left side half. Partial thyroid lobectomy unilateral. That means one side half. With contralateral subtotal. That means opposite side half. Contralateral means what? Opposite side. There are two lobes. One is right side, opposite side is left lobe. Both the lobes they are removing half. 60210, only half lobe is removed by the physician. That is partial thyroid lobectomy. 60212 is how we can read this code. Partial thyroid lobectomy unilateral with contralateral subtotal. That means one side half, opposite side half. 60220. What is it meaning? Total thyroid lobectomy. A total lobe they have removed. It may be left side or right side. Like that. The combination code you are getting. Why you coded both the codes? Dimple, you coded C. Why you coded C? When you are having a code
Sir, because of left lobe and right lobe.
C, what is the meaning of contralateral dimple? What is the meaning of contralateral?
Yes, sir.
Opposite side.
Opposite side.
The opposite side.
If you read the code description of 60212, read the code description 60212.
Partial thyroid lobectomy, unilateral,
Okay.
with or without.
With or without verity. After
Okay,
you,
sir.
semicolon is there or not?
Yes, sir.
Partial thyroid lobectomy unilateral with contralateral subtotal. One partial thyroid lobectomy
Yes.
means what? On right side or left side they removed half. Contralateral means what? Opposite side.
Yes.
Opposite side also they removed half.
Opposite side.
You are getting a combination code or not?
Okay, sir. The answer is 60212 only, sir.
Yes, yes.
Okay,
You
sir.
can see the question here. What the physician is doing? He is removing 1/3 portion of the right lobe as well as 1/3 portion of the left lobe. On both sides they removed partial only. 60212. Understood everyone this concept?
Yes.
Now I will draw the diagrammatic representations. You people can answer what is the procedure done by the physician. If physician done like this, what is this procedure done? Only this much is removed from the lobe. What we call it as?
Partial unilateral.
Lobectomy unilateral. Yes or no? Partial lobectomy unilateral. Now, for example, one side this one removed, opposite side also this one removed. then what we call it as?
Partial unilateral
Lobectomy
with contralateral.
with contralateral subtotal.
Partially.
One side half they removed, opposite side also half. Now this is the procedure done by the physician. What is this procedure name?
Contralateral.
This one.
Total thyroid lobectomy unilateral.
Unilateral.
Lobectomy.
Total thyroid lobectomy.
Now, if this is the procedure done by the physician on one side, opposite side half, then what is this procedure name? What is this procedure name?
Partial thyroid lobectomy unilateral.
Lobectomy.
Total thyroid lobectomy. Unilateral with contralateral subtotal.
One side total they removed, opposite side half. Now both the lobes they removed. What we call it as?
Complete.
Both the lobes.
Thyroidectomy.
Total thyroidectomy. Now you can see here. This first diagram indicates partial lobectomy. This second diagram indicates partial lobectomy unilateral with contralateral subtotal. Contralateral. That's opposite side also half. One side total lobe they removed. It may be right side or left side. Second, last one is one side total lobe they removed. Opposite side half. Both the lobes they removed. We call it as thyroidectomy. Understood everyone this concept? Understood everyone this concept? Still any doubts? Any doubts in this concept? Any questions from this concept? No? Okay. Next one, nervous system. Nervous system. Make heading. Now related procedures. Now related procedures. Write down. Codes are based on nervous system. Make heading. Now related procedures. Now related procedures. Codes are based on first point. Name of the nerve. What we need to identify first? Name of the nerve. Name of the nerve. Second point. Type of procedure performed. Name of the nerve. Second one. Type of procedure performed. In that A, that means first neurorrhaphy. Neuro. Neurorrhaphy. R-R-H-A-P-H-Y. Neurorrhaphy. Rhaphy means suturing. Suturing of nerve. If you want, what is the meaning of neurorrhaphy? Suturing of nerve. This is one of the procedures can be performed. Neurorrhaphy. Next one. Neurorrhaphy with graft. Neurorrhaphy with graft. Next procedure. Neurorrhaphy with graft. They are suturing the nerve with the help of nerve graft. Third procedure. Administration of anesthetic agent for nerve blocks. 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 Next one. Neuroplasty. Neuroplasty. That means surgical repair of nerve. Neuroplasty, that means surgical repair of nerve. Surgical repair of nerve through surgical repair of nerve through exploration of nerve, exploration of nerve, exploration of nerve, comma, nerve decompression, nerve decompression, nerve decompression, or neurolysis, neurolysis, neurolysis. Neurolysis. Next one, destruction of nerve, destruction of nerve, or chemodenervation, destruction of nerve or chemodenervation, destruction of nerve or chemodenervation. Destruction of nerve or chemodenervation. Next one, transection of nerve, that means removal. Transection of nerve, that means removal. Now, see, first, when we are getting a nerve related question, what we need to identify? Nerve related question, what we need to identify in the question?
Name of the nerve.
First, we need to identify the name of the nerve. Next, type of procedure performed. How many possible procedures a physician can perform on nerves?
Neurography.
Neurography, that means suturing of
Neurography with graft.
Next one,
Neurography with graft.
suturing of nerve with the help of nerve graft. Next one,
Administration of anesthetic agent for nerve block.
patients for nerve blocks. Next one,
Nerve block. Neuroplasty.
neuroplasty, how they can perform by neurolysis or nerve exploration, like this. This is the fourth procedure. Next one,
Distraction of nerve.
destruction of nerve or chemodenervation, that is the fifth procedure.
Chemodenervation.
Next one,
Transection of nerve.
that means
Transection of nerve.
removal of nerve. Understood?
Yes, sir.
These are the possible procedures a physician can perform on nerves. Now, can you see the code descriptions? Go for page number 473. Page number 473. 473. Are you there? 473 page number. Page number. Are you there, everybody?
Yes, sir.
Okay.
Yes, sir.
Can you see there anesthetic agent for nerve blocks? That is the first procedure. We need to look for the nerve. That's it. Here, can you read the code description 64405? 64405. Anyone? 64405.
Injections, anesthetic agents, and/or steroid. Greater occipital nerve.
Location of nerve is occipital. What they are doing? They are introducing anesthetic agent. Just we need to identify the nerve
Injection.
name. That's it. You will get the answer. We need to identify the nerve name. You will get the answer. Here, mark the important codes: 64479, 64480, 64483, 64484, 64484. Okay, now you can see the codes here. How we can read the code description 64479? How we can read this code description 64479? Anyone can?
Injections, anesthetic agent.
Okay.
Injections, anesthetic agent, and/or steroid. Transforaminal epidural with imaging guidelines. Fluoroscopy or CT, cervical or thoracic single level.
Now, first one, this procedure we call it as TFESI. If you want to just note down, transforaminal epidural steroid injection, TFESI. What is the shortcut for this procedure? TFESI. Now, here everyone have to recall the spinal related levels. On which level they are performing this procedure, cervical or thoracic. Now you can see cervical, how many segments are there? In anatomy we discussed, in cervical region how many segments are there?
C7.
7 segments are there. C1, C2, C3, C4, like that. Now C1 to C4, how many levels are there? In C1 to C4, how many levels are there? C1 to C4 total, how many levels?
3 levels.
4.
4 levels.
3 levels.
C1 to
Sorry, C1 to C2 1 level, C2 to C3
1
second
level.
level, C3 to C4 3 levels. Total how many levels are there? 3 levels.
3 levels.
Between 2 segments 1 level. Between 2 segments 1 level. Understood? How many segments are there? 4 segments. This already we discussed in anatomy. C1 to C2 1 level, C2 to C3 1 level, C3 to C4 another level. Now, what is the procedure performed by the physician here? TFSA, cervical or thoracic. Now, total here, if you see the scenario, total how many levels? 3 levels. 64479 for the first level, 64480 into 2 times for each additional level. Now you can give me the answer. T1 to T5. How many levels are there? T1 to T5. How many levels are there?
4 levels.
4 levels.
4 levels.
4 levels. If TFESI is the procedure performed on thoracic, how you will code?
64479 1 time.
Okay.
64480 3 times.
3 times. Understood everyone? Like that you need to code. Here the codes. Mark the codes. Some important 64479 80 83. This is for lumbar or sacrum. 83 84. Now come to the code 64490 90. Write down there. Facet joint injections. MBB. Shortcut is MBB. Medial branch block. 64490 at the code level. You just write down MBB or facet joint injection. Facet joint injection. What is the another term I am using? MBB. MBB. Medial branch block. Now, can you give me the codes? If physician performed MBB from C1 to C5. Give me the codes. Physician performed MBB from C1 to C5. Take this question and give me the codes. Physician performed MBB from C1 to C5. MBB from C1 to C5. How you will code? Suspita. 64492 when you are C basic Suspita. See below the code Suspita. See below the code under 64492. 64492. See below the code. Why you coded into 2 times? Already clearly they said only 1 time per day. It's a
Yes, sir. Yes, sir.
maximum we need to report only for 3 times. 909192. If they provide 5 levels also, we will code only 3. Understood now? We need to follow those basics.
Yes, sir.
See, answer for that question is 64490 for the first level, 64491 for the second level, 64492 for the third level, but fourth level we do not code. Why? Because do not report 64492 more than once per day. Maximum we will code for here 3 levels only. Understood everyone? As per the rule, no need to memorize the rule, just follow the code descriptions and the parenthetical note. Are you able to understand everyone? Any questions from here? Any questions from here? Any questions? Now mark the
Please report this once again. I
sorry.
didn't get it actually.
Sorry.
Can you repeat this once again?
See, code description 64490. Can you read the code description 64490?
Injections, diagnostic or therapeutic agent, paravertebral facet, joint, with image guidance, cervical or thoracic, single level.
See, this another name for this injection is MBB, medial branch block. Write down the medial branch block. How many levels perform? 90 means single level, 91 means second level, 92 means third level. Yes or no? The code descriptions is like that.
Yes.
Now, if physician performed, this code can be used for cervical or thoracic. If physician performed C1 to C2, C2 to C3. Total how many levels are here?
3 levels.
2 levels. Between 2 segments, 1 level. Yes, sir. Already we discussed this concept in anatomy. C1 to C2, 1 level. C2 to C3, 1 level. Total how many levels?
2 levels.
2 levels. Now for the first level, what is the code?
64490.
64490. For the second level, what is the code?
64491.
91. For example, if I have given like C1 to C5, how many levels are there total? C1
Four
to
levels.
4
Four
levels
levels.
are there. First level, the code is 90. Second level, the code is 91. Third level, the code is 92. Remaining fourth level is there. We cannot code. Why? Because maximum times we need to code only for 3 levels. A parenthetical note is there below the code. Do not report 64492 more than once per day. You cannot repeat the code into 2 times, 3 times. Only 1 time max. That means if MBB is performed for more than 3 levels also, you need to code only for maximum 3 levels. Understood the concept?
Yes.
Okay.
And 64492 is also saying third and any additional levels. Third and any additional levels.
Next one. See the codes 64493, 9495. Just write down again. MBB injection, but this is for lumbar or sacrum. Same concept, but the location on spine is lumbar or sacrum. 939495. 939495 lumbar or sacrum. Try to see one question. Question number 34. 34. Question number 34.
37.
34. Completed. Question number 34. What is the procedure performed? Transforaminal epidural injection. How many levels are there? One level. 652 S1. What is the code, everyone? If we go for 9394, that is MBB. 93 is MBB. Option A is 2 levels, but how many levels are performed? 1 level. What is your answer?
Only one level. 64483.
Everyone in the class, any difficulty in understanding the question? Is there any difficulty in understanding the question?
No, sir.
Okay. Now, I said you are getting case studies, right? In the examination, 33. Question number 33 is the case study for you. But again, I will explain, but this is very easy. You can see. L3 to L4 periarticular paravertebral facet joint injection is performed. Left side, L3 to L4 periarticular paravertebral facet joint injection is performed. Now, paravertebral MBB 1 level. What is the code?
64490.
Lumbar. Lumbar, Shubha, lumbar. Not
Okay.
64493.
64493.
64493. On only one side, right? Like that. D is the answer. Like that we need to code. Okay, anyway, I will show you the case studies. Just I am giving a hint for you. This is nothing but a case study that what they are asking in the examination. Again, come to the CPT book. I hope everyone understood those 4 codes. Next one. After that, go for the codes 64615, 64616, 64615, 64616, 64615, 64616. Chemodenervation means destruction of muscles. For what? What is the cause? Chronic migraine. 64615. If the destruction of muscles is for the condition cervical dystonia, spasmodic torticollis, 64616. Chemodenervation means what? Destruction. You need to identify the noun name and we can go. I will show you one question. Now question number 40. Who will explain me this question? Usha, can you explain me the question number 40? Question number 40. What is going on in the question? Remaining people you can do. Question number 40.
15 years old has been taken to surgery for crushing his index and middle fingers,
Okay.
injuring his digital nerves.
Okay, what
The
is
physician
the nerve?
located
Underline what are the nerves here involved?
digital nerves.
Digital nerves. Okay.
The physician located the damaged nerves in both fingers and sutures them to restore sensory function. What CPT codes are reported?
I told you a series of procedures. In that, what is the procedure performed here by the physician on the nerve? Is there any anesthetic agent here administered? Usha? Any anesthetic agent administered in this question? Any block, anything
No,
like
sir.
that they are saying? No.
No, sir.
Is there any suturing of nerve?
No, sir.
Suturing
So,
of also not there.
Sutures them
Yes,
to
yes. Fingers and sutures them.
Yes, suturing is there or not?
yes, sir. Sutures is there.
Then what is the procedure performed? Like that. See, there are maximum 6 procedures they can perform on a nerve. What is the procedure performed on nerve? In that, out of 6, you need to identify the procedure name. Here clearly they are stating suturing. That means what is going on? Suturing of nerve is going on. Then you can go and select the code. Like that, you need to answer nerve related procedures. Understood everyone? Neurography is the procedure performed. What are the codes? Location of
64831, 64832.
location of the nerve is distal nerves. Just you need to read the code and you can rule it out. If you go with 64831, like that you can read the codes and you can rule it out. Everyone try to answer everyone. Okay, everyone D is the answer. Any questions? Okay, do one more question. Question number 42. 42. Question number 42. Completed question number 43. Sorry, 42, right? 42. First point, what is the name?
No.
What is the name of the nerve? What is the name of the nerve here?
Facial nerve.
Facial
Facial nerve. What is the procedure performed by the physician on the nerve?
nerve graft.
Neurotherapy with nerve graft.
Neurotherapy with nerve graft.
Underline that one. Now go and read the code description. 64885. 64885. Nerve graft, head or neck. Facial means comes under head, right? Head or neck up to 4 centimeters in length. How much centimeter they are doing that one?
2 centimeters.
Centimeter. Maximum less than
3 centimeters.
Now 64885. Yes sir? No? Now can you see the code 69990? That is an operating
Microscope.
Operating
But do not conjunction.
Now when you go with the code description, everyone, just go with 69990. Six triple nine zero.
508, sir, page number.
Okay. Now, in all these codes, operating microscope is included. Do not report 69990 in addition to the procedure is there. In all those codes, operating microscope is included. If the code is not present here, if any operating by using an operating microscope, if a procedure is performed by a physician, you can code it separately. Now can you tell me 63075 to 63078, that is the range. In that range, operating microscope is included. Understood? Range may be there. Here codes are there. Always see it properly. 650912, 68850, operating microscope is included. Now what is the code you are having? 64885. 64885 in this range or not, you can see. Yes or no? 64885, it is comes under the range 65091 to 68850.
Yes, sir.
It comes under this range or not? No? 64, right?
Yes, sir.
Okay. No. 64 means it not comes under, it is 65 range, right? 65 range. 64820 to 823 is there. 64912
Yes,
to
sir.
64913. That means operating microscope is not included. We need to code it separately. What is your answer? D is your answer, right? Again, I am telling the question. See, nerve name you identify and the procedure performed. As I said, there are few procedures that can be performed on now. Here, what is the procedure performed by the physician? Neurography with graft. You got a code 64885. Then that is in two options, A and D. 69990 is an operating microscope code. I went to the code. Here there are some codes where operating microscope is included. I saw my code as 64885. Is it included in that code series or not? No. That means operating microscope, I need to code it separately. What is the answer? D is the answer. Understood, everyone?
Yes, sir.
Okay. Like this, we need to code now related procedures. Next, make heading spine related procedures. Spine related procedures. Spine related procedures. Try to recall the structure of spine. How many regions a vertebral column is made up of? Try to recall the anatomy. How many regions a vertebral column is made up of? How many regions? Anyone in the class?
5 regions.
5 regions. What are they? Cervical region,
Cervical region, thoracic region,
lumbar,
lumbar, sacral, coccyx.
sacrum and coccyx. Yes or no? No. C1 to C7. How many vertebral segments are present? C1 to C7.
7 segments.
7 segments. How many levels are there?
6 levels.
6 levels are there. See, each one will be considered as one segment. Between two segments, what we call it as one level. 6 levels are there. Now you can see the diagrammatic representation. See, the spinal cord looks like this. Already we discussed during the anatomy session. This is one vertebral segment. This is one vertebral segment. Side projections will be there. Upper projection will be there. This is the diagrammatic representation of one vertebral segment. See, this is body. We call it as vertebral body or corpus. What we call it as? Vertebral body or corpus. These are transverse process. This is spinous process. Here that is nothing but facet. And this portion is known as lamina. This is known as foramen, neural foramen. Always these terms are important. What are the key terms that we will get here? I know. Key terms regarding spine. Key terms regarding spine. First one, location on spine. Key terms on spine. First one, location on spine. That means cervical, thoracic, lumbar, etc. Second one, levels are segments? How many levels are how many segments? Second point, what we need to look for, how many levels are segments involved in procedure? How many levels are segments involved in procedure? How many levels are segments involved in procedure? Third one, parts of vertebral segment. Parts of vertebral segment. One segment, right? Vertebral body or corpus. At least you can try to recognize the names. Vertebral body or corpus. Lamina. Lamina. Facet. Facet. Foramen. 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 Which spinous or transverse process. Spinous or transverse process. Spinous or transverse process. Spinous or transverse process. These are the parts of the spine. Understood, everyone? Now you can see the important spinal cord. First mark the codes. 62321, 62321, 62321. What is the code description? That is epidural or interlaminar steroid injection. That is the common procedure done in outpatient. 62321. Are you able to see the code 62321? Everyone?
Yes, sir.
62323. It is for lumbar or sacrum. 62323. Mark those two codes. Next, 62290. 62290. 91. That is discography. As you know, if you want to just note down, between two intervertebral segments, what is present? Intervertebral disc is present. Between two segments, one disc is present. If you want to just intervertebral disc, what we call it as intervertebral disc. 6229091 discogram. Now see the codes here. Can you read the code 63001? Anyone? 63001. 63001. Anyone in the class?
Laminectomy with exploration and or decompression of spinal cord and or cauda equina without facetectomy. Foraminectomy or discectomy. One or vertebral segment cervical.
See here. What is the procedure done by the physician? Laminectomy. What is the purpose? Spinal stenosis. How many segments they are removing? 1 or 2. On which location? Cervical. Okay. And is there performing facectomy, foraminotomy? No. You can see the key terms, what I said on spine. All the key terms are in this code description on it. You can cross check. Here in that lamina is there, facet is there, foramen is there, segment, disc. Okay. Understood, everyone? you need to understand the code description so that you can answer easily. Can you see 63015? 63015? 63015? Are you able to understand the code description? 63015. Yes, sir. Do we understand this code description?
Yes, sir.
Okay.
More than 2 vertebrae
Yes.
sir, working.
Now you can practice one question. See question number 50. See, try to do everyone. As I said, surgery maximum is based on anatomy and terminology. Just I am guiding you the path. Question number 50. See, are you able to understand the question? Laminectomy is performed in the question. Yes, sir.
Yes, sir.
Okay. Now, if you see 63005, laminectomy with exploration and/or decompression of spinal cord and/or cauda equina without fascectomy, foraminotomy, or discectomy. Whereas 63047, if you see, 63047. Laminectomy, fasectomy, foraminotomy, unilateral or bilateral races, stenosis, lumbar. Now what will be your answer? 63005 or 63047? You can see under general anesthesia, a knife dissection was made on the back, take down to the fascia. The fascia on the right side of the spine was stripped. The deep talar retractor was placed using an intraoperative X-ray traced out the foramen. There appeared to be some compression in the lamina into the foramen and a significant stenosis. The physician removes the spinous process and lamina. You can see nerve root canals was freed by removal of the patient. It indicates clearly what is the code.
63047.
Like that we need to understood. I said you the key terms that you need to understand from the question. I hope so everyone understood. Yes sir.
Yes, sir.
Okay. This is the way we need to code spine related procedures. Next one, brain related procedures. Say I'm telling you the key terms that you need to implement in the questions. Always see below the quotes. Parenthetical note plays a major role in surgery. Don't forget that one. Parenthetical note. Go for brain related procedures. Page number 460. Page number 460. Page number 460. Mark the code in your book, in your textbook. 62223. 62223. VP shunt. What we call it as VP shunt. I don't. Ventriculoperitoneal shunt to drain fluid. Shunt is used for what? To drain fluid from one location to another location. We call it as VP shunt. Six triple two three. Shunt. What is the role of, what is the use of stent? Anyone in the class? What is the use of stent? What is the use of stent?
Enlargement of space between.
Dilation. Stent is used for dilation. Shunt is used for drainage. Yesterday only we discussed. Stent is used for dilation. Shunt is used for drainage. Now here the concept, we just go with the concept here. Are you able to see page number 457, stereotactic radiosurgery? Stereotactic radiosurgery. In that concept, in page number 458, you just mark the paragraph 61796, 61797. The lesion diameter is less than 3.5 centimeter. 61796, 61797. What is the lesion diameter? Less than. What is the lesion diameter? Less than 3.5 centimeter. You can see the next paragraph. The lesion diameter is greater than 3.5 centimeter. That is complex. Now you can see the code descriptions. 61796 means simple cranial lesion means what is the diameter? Less than 3.5 centimeter. Now take one question and give me the answer. 6 simple cranial lesions are destroyed. Take the question and give me the answer. 6 simple cranial lesions are destroyed by using stereotactic radiosurgery. 6 Simple cranial lesions are destroyed by using stereotactic radiosurgery. Give me the answer. Shobha, don't be in a hurry to do the questions. Try to read the code description, parenthetical notes and everything. Otherwise, you may do so many wrongs. Try to read the codes. Try to read the parenthetical notes. So let's see, are you doing?
Oh,
Completed. What are your answers? Tulasi, what is your answer?
1797.
See, Geeta Kumari, why you carried again 61799 into 4 times? Total how many simple cranial lesions they are destroying?
6, sir.
6 they are destroying. First lesion, what is the code? For the first lesion, 61796. Yes, sir.
6197. Yes, sir.
From you can see from each additional cranial lesion, what is the code we need to use? 61797. 797. And see how many remaining are there? 5 lesions are remaining. Yes, sir. But if you see the parenthetical note below the code, we can use maximum this code only for how many times? 4 times.
4 times.
61797.
4 times.
61796, 61797 into 4 times, like that. See, follow the parenthetical note. 61798, 61799 is a pair. That is for complex lesion. Understood, Geeta Kumar? You coded both 2 codes.
Sir, I didn't understand, sir.
See, total how many lesions
Hello,
are destroyed?
sir?
Yes. Total how many lesions are destroyed?
I didn't understand.
See, that's what I'm
6
explaining.
lesions.
Total how many lesions are destroyed?
6.
6 lesions are destroyed. Okay, can you see the
Yes,
parameter
sir.
for first simple cranial lesion? What is the code?
61796.
61796. 61797 is used for
Additional
Single.
cranial lesion.
additional cranial lesion, simple. Now see below parenthetical note under 61797.
More than 4 times.
No more than once per session. Do not report any combination of 697 more than 4 times for entire course of treatment. Yes, sir. We cannot report more than 4 times. Is that clear?
Yes, sir.
Okay. Now 61799 is a complex lesion, but I didn't give you the complex. I have given only simple cranial lesion. 6 are destroyed. 61796 for the first lesion. How many lesions are remaining? 5, but we cannot code for 5. We are coding up to 4. 61797 into 4 times. Understood?
797.
Is that clear?
Yes, sir.
Yes, sir.
So like this we need to code. So just take the questions, practice at home. Tomorrow I will tell you the answers based on the today's session. Take the questions, question numbers. Tomorrow we will complete IN, remaining part of nervous system. I here. Take the questions. Question number 24, 24, 30, 30. Question number 24, 30, 36, 36, 37, 37, 39. These questions practice at home. Understood? See, if you are good in anatomy, you will understood the surgery part very easily. I am telling to you all, please go through the nervous system. Once you complete a nervous system, revise the anatomy of digestive system and genitourinary system. Once you completed the anatomy of nervous system, eye and ear, go for digestive system and genitourinary system. Before starting off the class, I am telling you, the next topic I am going to start is digestive system. Please go through the digestive system anatomy and terminology of the digestive system. You will understand very easily all these sessions. Otherwise, again you need to recall all your anatomy and everything. Understood what I am saying? When you are reading a code description, The code description is based on anatomy and terminology or not? Whatever you have read so far. Yes, sir. Which plays a major role in understanding the code descriptions here in surgery? Anatomy and terminology or not?
Yes, sir.
Okay, please go through that nervous system anatomy, digestive, genitourinary this week. Okay, I will complete these sessions for you in this week. Please practice the questions what I have given for you. Yeah, Vishnu, yesterday you were asking a question, but I closed the session. Are you there in today's session?
Yes, sir. Yes.
Yes, Vishnu, what's your question?
Nothing, sir. After 23rd, the classes will be completed, right?
See, after the completion of the total course, Vishnu, okay, the admin person will give you the timetable to practice the papers. You people will practice in a week, and every Sunday or Saturday, I will take a doubts discussion session. You can ask me any type of doubts. I will give you backup like that for 1 month for your batch. Once
Okay.
of my syllabus, okay. If
Okay.
unknown topics you are getting during practice sessions, you can ask me in the doubts discussion session. That's what I'm doing, Vishnu. Once I'm completing the theory part, then I will make you practice during the practice sessions. If you are getting doubts, every week, 1 day, there will be a doubts discussion section for you all. Any other queries?
Okay, sir.
More, as per new syllabus, the exam was done. So, will that be available, that question paper?
Yes, that question only we will make you practice. Already we are giving to previous batch students. Once I completed the total syllabus, we will give you to all. Okay, we are having 5 to 8.
So if you have to give the exam in Feb, for example, after mid Feb, then when to register? This month?
Feb first week. Dates are not yet released, but they will release Feb first week.
Means in Feb first week you want to say?
Yes, you need to register in Feb first week.
To book the slot for the same month?
Yes.
Okay.
Thank you everyone.
Thanks.